My name is Lynette Schick. I'm here from the Mental Health Commission of Canada. I won't be joining as the moderator for the entire session today. We have two fantastic Youth Council moderators, Miriam and Alexandra. I just wanted to introduce them and they'll help get us started. Over to you, folks.
Thank you very much. Alexandra, are you here?
Yep.
Perfect. So I'll let you start with the welcoming.
Okay, thank you so much. So hold on a moment. So hello, everyone, and welcome to today's webinar series on cannabis and mental health, hosted in partnership between the Mental Health Commission of Canada and the Canadian Centre for Substance Abuse and Addictions. This is a three-part series, and today's webinar, the focus of today's webinar will be youth experiences of cannabis and mental health. I'm Alexandra, and I'm a member of the Mental Health Commission of Canada's Youth Council. And Miriam?
Yeah, hello everybody. My name is Miriam Makuzi. I have been a MHC Youth Council member for the past 4 years, and I'm in Jogjagan at the moment, Montreal, Quebec. And I'm currently doing my PhD in community psychology in Montreal as well. So before we begin, we would like to acknowledge that the MHCC and CCSA are both located in Ottawa on the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation. As those who are participating today are located across Canada, we invite participants to acknowledge the territory you are joining us from today in the chat box. Thank you.
All the research presented today was made possible through the community-based research grant at the MHCC and the Closing the Gaps initiative at CCSA, with funds provided by Health Canada in support of cannabis research. We are pleased to be offering this webinar in both languages. Today's webinar will be presented in English with simultaneous interpretation in French. To listen to French, click on the interpretation button at the bottom of your screen and select French as your preferred language. Please note that live captioning will also be available in French and English. The slides are also available for viewing in English or French. French and English versions of each presentation will be played simultaneously. You should see them on your screen side by side, separated by a vertical line. To resize how you would like to view the English and French versions, slowly pull the vertical line towards the center of your screen. One version will expand and the other will reduce in size. You will hear from 4 research teams today, sharing preliminary findings of their work. There will be a brief Q&A period at the end of each presentation, and then again at the very end, if time permits. Please feel free to type in any questions for the presentation in the Q&A box. If you run into any technical difficulties, please use the chat box and our facilitator will help you out. Also note that a recording of the webinar will be posted to the MHCC's website sometime in March, so please stay tuned for that.
With all of the housekeeping out of the way, I'll turn it over to the first team to get us started. Please help me in welcoming Dr. Scott Leatherdale from the University of Waterloo. Over to you, Dr. Leatherdale.
Welcome to my presentation titled Cannabis and Youth Mental Health, a Snapshot from the COMPASS System. My name is Dr. Scott Leatherdale and I'm the Principal Investigator for COMPASS. I'm also a Professor and University Research Chair at the University of Waterloo. As background, the COMPASS study, which started in 2012, is a prospective cohort study designed to collect hierarchical longitudinal data from a sample of over 200 secondary schools and the approximately 65,000 grade 9 to 12 students that attend those schools. We're currently in 4 provinces, Ontario, Quebec, Alberta, and British Columbia. Each year, we collect longitudinal data from students attending those schools on a variety of different topics. For interest here is on cannabis and mental health. And then we also collect school level data on their programs, policies, and built environment resources across all the different domains we're measuring in COMPASS. And we do this annually. So let's go into a few highlights from the COMPASS study that are relevant to this topic. As context, let's set the background by talking about some trends in cannabis use we have from the COMPASS data. And as you can see here, over time, cannabis use, both current cannabis use, which is the blue line, and occasional cannabis use, has declined over time in the COMPASS cohort. What's interesting, you can see that the decline in both occasional and current cannabis use started prior to cannabis legalization in 2018, and you can see it's continued to decline since the onset of the COVID pandemic. With respect to cannabis use and mental health, I guess the overall summary based on our data to date would be two things. One, students who used cannabis commonly indicated they had mental health challenges. However, our results tend to suggest that depression and anxiety were not directly associated with cannabis use. Other factors, such as co-occurring substance use, physical activity, screen time, etc., they're involved in these relationships, which make it complicated. So it seems like it's more of an indirect association, the link between cannabis use and mental health. And second, flourishing, which is an indicator of positive well-being among youth, appears to actually be directly associated with a lower likelihood of overall youth cannabis use. Starting with the cross-sectional evidence, which is a weaker form of evidence, a study by Butler and colleagues using the IRER5 data examined predictors of current cannabis use, which is any use in the past 30 days. Both depression and anxiety were not significantly associated with current cannabis use. Flourishing, an indicator of mental well-being, was associated with a decreased likelihood of current cannabis use. And other forms of substance use, primarily alcohol and cigarettes, was associated with an increased likelihood of current cannabis use. A follow-up study by Romano and colleagues using the IRER6 data examined predictors of past year cannabis use. Consistent with the first study, anxiety was not associated with past year cannabis use. Flourishing was associated with a decreased likelihood of past year cannabis use. And other forms of substance use was associated with an increased likelihood of past year cannabis use. But in this study, again using a less sensitive outcome of past year use, depression was associated with cannabis use over the past year. With respect to longitudinal evidence, which is a stronger form of evidence, the first study was done by Duncan and colleagues using the IRER5 to IRER6 longitudinal data, and this study examined if changes in cannabis use frequency were associated with changes in mental health and whether meeting physical activity guideline moderates these associations because there's a strong link between physical activity and mental health among youth. This study found that increasing from infrequent to more frequent cannabis use over a 1-year period of time was associated with increases in depression. However, this was only among youth who were physically inactive. These associations weren't present among kids who were physically active. However, the study also found that decreasing from a high frequency of cannabis use to a lower level of cannabis use over time showed improvements in depression, but not anxiety, among all youth, regardless of their physical activity level. Another longitudinal study by Doggett and colleagues used the linked longitudinal data from year 6 to year 7, and this study examined mediating pathways between screen time sedentary behavior, internalizing symptoms, which is an indicator of both depression and anxiety simultaneously, and cannabis use. This study found that there's a multidirectional relationship between cannabis use, mental health, and screen time. So internalizing symptoms, both depression and anxiety, partially mediate the association between screen time and cannabis use. What this means is that screen time predicts mental health, which then predicts cannabis use, but then mental health can also predict screen time, which then also predicts cannabis use, suggesting there's potentially a bidirectional relationship. Another longitudinal study by Zuckerman used the year 6 to year 7 data, and this study was slightly different. It examined changes in cannabis modes of use, so whether you smoke, eat, drink, or vape cannabis, and then linked those changes to correlative risk factors over time. When compared to a cannabis user who reported only a single mode of use at baseline, the study identified that if you reduce the number of modes of use over time, it wasn't significantly associated with depression or anxiety. If a student increased the number of modes of use over time, this also wasn't significantly associated with depression or anxiety, so changing the number of modes of use over time didn't really matter with respect to mental health. However, students who maintained multiple modes of use over time, so students who were using cannabis in multiple forms at baseline, those students were significantly more likely to have increased depression, but not anxiety. It's hard to talk about the link between mental health and cannabis use without also considering what's happened since the onset of COVID, and Compass has these data available. Using the Compass data from the pre-pandemic period to the current period, you can see there's been an ongoing decline in cannabis use among kids. There was the sharpest decline during the immediate lockdown period, and that things normalized moving forward. Although you can see there's differences in the rate of decline among students who opted for in-person learning versus those who opted for online learning. Interestingly, a recent study published by Romano using the Compass data found that only 4% of students in our cohort reported that they were using cannabis to cope with COVID. When you look at mental health, it's a different picture than we see with cannabis use. You can see here that the prevalence of students reporting clinically relevant anxiety symptoms has increased fairly markedly since the onset of the COVID pandemic. We also see the same rapid increases in clinically relevant depression among kids since the onset of the COVID pandemic, especially among kids who have opted for the online learning experience. So, what does this mean? Well, first, implications with respect to the legislative review are as follows based on our preliminary data. First, the Cannabis Act does not appear to have led to dramatic declines in youth cannabis use. We're finding very few youth are actually reducing their cannabis use as they progress through school. Second, transitioning to more frequent cannabis use over time is related to more negative outcomes. It's associated with polysubstance use, physical inactivity, and screen time. Third, 2 in 5 youth cannabis users in our sample actually expanded their modes of cannabis use since the start of the Cannabis Act. Remember, our evidence suggests that more modes of use is associated with elevated depression. This suggests that screening for multiple modes of cannabis use may actually help identify the highest risk users among youth populations. Fourth, it's hard to find a cannabis user who doesn't also use alcohol or vape. Our data suggests by the time students are in grade 12, only 2% of youth are primarily only using cannabis as a substance. Remember, alcohol and cannabis follow similar patterns of development, with alcohol being more common. As such, we think prevention efforts would benefit from being polysubstance focused, especially in relation to the link between substance use and mental health among youth populations. Fifth, very few youth report using cannabis as a coping mechanism during the COVID-related shutdowns. Alcohol was actually more commonly used, even though it wasn't that common, only 8% of youth. And finally, a flourishing appears to be a protective factor for cannabis use. With respect to implications for the general audience, well, cannabis use doesn't appear to be directly related to anxiety among youth in our sample. Second, there may be some link between cannabis use and depression, but this relationship is complex. It's likely bidirectional, where depression can increase cannabis use, or increased cannabis use may be related to increased depression. And we know that cannabis use often co-occurs with other substance use, and evidence suggests that poly use is actually more important for depression than cannabis use on its own. And finally, other modifiable lifestyle factors such as physical activity, screen time, and social relationships appear more important for shaping youth mental health, but those factors are also associated with cannabis use. So we need to look at this from a comprehensive standpoint with youth and not just focus on the link between cannabis use and mental health. What are some of the barriers we currently face? The 2 main barriers we face are the impact of in-person school closures due to COVID-19, although we've mitigated this quite well. And the second barrier is this is the last year of funding for Compass, although we are waiting on extension funding from CHR and Health Canada moving forward. I'd like to acknowledge the funding support we've had from CHR and Health Canada and my team. There's a link to our website if you want additional information, the link to our KT videos, my references, my motivation. Thank you.
Thank you, Dr. Leatherdale, for a great presentation. We now have some time for a question and answer period with our audience. We'd like to remind you that for your question to be answered, you must first type it into the Q&A box. Please feel free to ask your question in English or French. It is possible that we will not have time to answer all the questions that are asked today. If this is the case, we encourage you to contact the research team directly. So we have a first question for you, Dr. Leatherdale. Could you define flourishing?
The easiest way to define that is it's in a spectrum of well-being with youth. So youth can either be flourishing, which is an example where they're happy with what's going on in their life, they're proud of the outcomes they're working towards, they have a good home life, positive mental well-being, things like that. Or youth can be languishing, which is mean where they're struggling mentally and emotionally with things going on in their life. So it's measured on a scale. It's more of a generic term for what's at the one end of the spectrum, where these are kids who are doing incredibly well with respect to their situation in life and how they're feeling about themselves, within that position, regardless of the other things that are actually going on in their life. So some people call it a bit of a measure of resilience. That's another term that can be used, but for the scale that we're using in Compass, it's called the flourishing scale. So that's kind of what it refers to. If anyone wants the specific measure that's being used, just reach out to me directly and I'm happy to share it.
Thank you. We also have another question. So Steve Keller says, you mentioned that cannabis use showed a sharp decline at the beginning of the pandemic. Then the data seemed to show a return to pre-pandemic numbers. Were there common factors that played into this decline and ensuing increase?
The suggestion we would have from our data and what's available to us is the reason for the sharp decline is because kids were at home with their parents. And one thing to remember with this age group, often kids who are using substances, their parents are unaware that they're using these substances. That's pretty common. The literature shows that most kids aren't telling their parents if they're using drugs or alcohol or if they're smoking. So when the pandemic initially started and there was the lockdown in place and kids were at home with their parents, a lot of them lost the social access to accessing cannabis and also the social opportunities to use cannabis because they were at home with their parents. And then you can see as things started to open up again and kids were back at school and they were allowed to socialize more, you saw a bit of a rebound effect with their cannabis use. And I think that makes sense from the standpoint of both availability and the social aspects of their use. Like anything, there were some users who consistently used through the pandemic. That's why we didn't see it drop right to zero. But for the majority of youth, we saw a pretty sharp decline. I hope that answers your question.
I'm sorry, my AirPod disconnected. So
oh, no worries, no worries.
I think I heard that you finished you finished answering the last question, correct?
Yeah.
Perfect. I have two questions here. Will the presentation slides be available? I think they will.
Yeah, we can share them with. I don't know if your group is sharing them or if people reach out to me. I'm happy to share the slides. If you want them without the audio, I can also share them without the audio as well.
Perfect, thank you. And I have another question. So Alana Roscoe is asking, I didn't quite understand what was meant by internalizing symptoms.
That's just a common term for both depression and anxiety. Could also be referred to as internalizing symptoms with respect to mental health or poor mental well-being among youth.
Okay, thank you. So I have another question in the chat. Hello, since school closures were different in Quebec, was this difference expressed in your data?
For the data that I presented in this slide, that was specific to only what was available for the Ontario schools. We're currently in the process, now that we completed last year's data collections and we have the clean data sets available, we're in the process of doing the longitudinal papers that are exploring, what was the impact of the COVID pandemic on youth, substance use across a variety of substances, and mental health. And we are able to explore the provincial variations in those models. So we currently just finished the papers associated with cannabis use. And yes, we're looking at what differences you'd see between, say, Quebec, Ontario, British Columbia, and Alberta, because there are all slight variations in what happened with the timing of the lockdowns or what was involved with the lockdowns. So that is something we're exploring in the data moving forward. We also have one additional year of data within those models that we're modeling based on what was presented there. And the other important caveat I should say is for the slides that were presented here on what we saw during the initial pandemic period, those were unadjusted estimates. That was just the actual observed data that we were seeing. And now in the models that we're running with the linked longitudinal data, we're actually going to be providing adjusted estimates. So if people are interested in the work that's coming out there, hopefully those publications should be coming out in the next few months, and we post all of the publications on our website, or we actually tweet the links to the articles as well as they start to come out.
Thank you very much. We do have a couple of more questions, which right now we will have to move to the next presentation, so we might have some time at the end to answer them.
Thank you so much, Miriam. Next up, we will hear from Dr. Cecilia Benoit and her research assistant, Zach Maaz from the University of Victoria.
Hello, my name is Cecilia Benoit. I am a scientist at the University of Victoria and the principal investigator on this project, which is called Youth-Led Low-Risk Guidelines for Cannabis Use for Individuals aged 13 to 18. I'd like to acknowledge the territory which UVic stands on, which with respect to the Algonquin speaking people, and also the Songhees, the Squamish, and Wasonic people, whose historical relations to the land our university has today. So our project is interested in cannabis use among youth in our society, which our surveys show is quite common. And right now we have no low-risk guidelines for youth who continue to use and choose to use cannabis. So we were interested in identifying factors that are associated with both positive and negative experiences of cannabis use for youth, assessing the appropriateness of existing guidelines, and then assisting youth, helping youth to assist us in developing and evaluating some guidelines for appropriate use. So our questions were, how can youth who use guidelines manage their risk and for negative experiences? And how can youth who use cannabis facilitate their chances for positive experiences with cannabis use? Along with myself, Richard Gifford Card at the University of Victoria is a co-investigator. Barbara Thompson is the principal knowledge user from the Victoria Youth Clinic, as well as 2 physicians who work with youth. And we have 2 other investigators and 2 youth on our research team. So low-risk guidelines, as everyone would be aware, are really a harm reduction strategy to reduce harm and at least minimize harm for certain kinds of behaviors. And guidelines have been developing for people who wish not to abstain. And so, and these recommendations in this case are specific to cannabis use. There are really no good guidelines out there for youth. There are a number of some good guidelines have been recently developed for adults. And there's usually the guidelines that exist ask youth to abstain and then until they become an adult. And so we wanted to build on these existing strategies. To do so, we wanted to include the voices of youth. So we put together a youth working group at the Victoria Youth Clinic, our community partner. And they were meeting with us roughly monthly to give us feedback, and this is via Zoom because of COVID, either feedback in person or via Zoom or via email later. And we use that information to help us guide our development of guidelines. At the same time, the youth are helping us develop a cannabis experience survey, a national survey for youth between the ages of 16 and 24 about cannabis use. And this information will also be useful for us when we try to finalize the youth guidelines. That's the aim of our project. The youth have been on our working groups, have been giving us input all along the way. We shared with them a couple of adult inventories around cannabis use, and they have evaluated these, give us feedback, telling us whether the questions were youth appropriate and so on. They also shared with us information about our honorarium and about our advertisement for the large survey, how we should advertise, and also about which communities we should circulate in. We also done in the last year a rapid online review of existing cannabis guidelines from government and other sources. And we collect these together for a total of 52 guidelines or recommendations, and we shared these with our working group. Youth input on these 52 were that 31 of them they all agreed on. They thought they were really appropriate for youth. 21, there was a mixed review, but no guidelines were completely rejected. So we used this information then to develop our survey, and which is in process now, and we're hoping to release early this spring. So research impact, we are developing low-risk guidelines for youth aged 13 to 18. We're involving youth in our projects, and we're developing a survey to get youth experiences of cannabis and also identify other knowledge gaps that we can do future research on. Our main takeaways: youth continue to use cannabis despite abstinence education. There aren't appropriate low-risk guidelines out there for youth, and so we're hoping at the end of our project that we'll have more information that will be helpful in this direction, and then, of course, build on what we know for future research. So our next steps is to launch our survey, finalize our list of existing guidelines, finish the survey, do our analysis, get youth input, and then at the end of the day, finalize the guidelines and to evaluate the whole research process ourselves. So thank you very much. I look forward to receiving your questions.
Thank you, Dr. Benoit and Zach, for a great presentation. Now we have a few questions, and now we have some time for a question and answer period with our audience. We would like to remind you that your questions, will be we would like to remind you that for your questions to be answered, you must first type it in the Q&A box. Please feel free to ask your questions in English or French. So in terms of questions, hold on a moment. We're just getting them to load. If you just please give me a moment. Miriam, the questions are not coming up on my screen. So would you be able to answer any of these questions?
Of course, yeah. So we have a question here from Sam Kruger. Was there a common theme among the 31 resources that you identified as appropriate?
Zach, do you want to take that question, please?
Yeah, I can take that for sure. So overall, kind of there was no really unifying theme besides, of course, their guidelines to help youth use cannabis. I would say the biggest thing that I noticed personally, and that a lot of us noticed, is that they were really focused on safety. So I believe a lot of the fully supported guidelines were things such as like what to do when someone is having a bad experience, or if you're having a bad experience, as well as things such as setting up safety plans or informing friends when that's possible of, you know, you're going out, you're going to be doing a substance, and then just in case something happens, they're aware of that. So that would probably be the biggest thing that I noticed, theme-wise at least.
Great, thank you. We have a second question now. It says, great presentation and a very helpful initiative for you. My question is, do you think the federal government's regulation regarding promotion and discussion regarding cannabis use for anyone under the legal age would impact your project's ability to get its message out to youth in this age range?
I think we have, you know, government regulations, and then we have lived experiences of people and behaviors, and so I think our project will produce some harm reduction guidelines from the youth themselves. We have 6 youth who've been working with us across the project, giving us really considered recommendations. And so I think that when we do our survey, we'll get then a much larger response from youth across the country. And I believe that message will still be clear to young people. They'll still listen to it. And even though there'll be there could be different recommendations coming from the federal government. So I believe there's often a nuance that takes place when research is disseminated that is not necessarily impacted by what government decisions are. Thank you.
Okay, third question, great idea to adapt these guidelines. What is the social acceptability of these guidelines in schools, etc.?
Zach, you can probably add to that, but we actually don't know. Again, they, I think in schools mainly is don't use. but we haven't actually contacted schools about this. In the earlier presentation said parents usually, young people don't open up even to their parents. So I think there's a discrepancy between people's behavior and then what authorities know about that behavior, especially for people under 18. So that's a good question, and perhaps one that we can put to our working group of young people to ask what the experiences are.
I will actually just jump in and so I do know that schools are really against kind of, I guess they would view this as allowing kids to use substances. So I do know a lot of schools are against that, but more so in my research, I did find some community centers or youth centers that did support and actually provide the guidelines I took the recommendations off of. So I think it really depends on kind of if it's government funded or if it's more like a youth center.
Yeah, and I could add that the Youth Center, Victoria Youth Clinic Society, where we are conducting our research, is very much, and it's connected to a whole series of youth clinics across the province, and they're very open to this kind of harm reduction strategy to work with young people to if they are choosing to use cannabis, then to do so safely and you know in a place where other people are present, hopefully, and so thinking about it realistically. Thank you.
The next question is, apologies if I missed this, but when do you anticipate these harm reduction guidelines to be ready for distribution?
Good question. We are aiming to complete our full project and have our report finished by the end of this year, so mid-December. And we already have, Zach has been leading a kind of rapid review, so we have an article under review right now for one part of the project, but the survey and then the systematic review that we'll be doing will hopefully be all included by the end of this year.
Okay. And for our final question, it says, how do you foresee these guidelines being translated to youth? Is it mainly school education or other areas of reach?
And Zach, you can add too, but I think we're going to use as many media sources as we can to disseminate our results and get these guidelines out. We've got a lot of the survey itself that we're using. We're using multiple media sources to gain access to youth to complete the survey. We're hoping maybe 600 or more students or young people will complete the survey, and then their results then we'll compile. So we will use multiple mechanisms to try and get the results out. Zach, you have anything to add?
Yeah, I will just want to add that that is a question I believe we are going to put to our youth working group. So we will get more ideas from them that will probably help a lot in that regard. Thanks.
Wonderful. Thank you so much. Over to you, Miriam.
Thank you. Yeah, thank you so much for a great presentation. Next up is the third presentation by Dr. Suzanne Archie from the McMaster University. We're excited to be joined by their team here today.
My name is Suzanne Archie. I'm a psychiatrist, and I'm also the Equity, Diversity, Inclusion Director for Postgraduate Medical Education and the chair of the Anti-Black Racism Task Force. As you know, simply educating youth about the risk of marijuana is not sufficient. Youth, and particularly Black racialized youth, may not be aware of some of the risks. New and novel strategies are needed to address these issues. My funding sources include the above. I've had a non-financial partnership with Moonray Studios of Hamilton, a multimedia company. And I've been blessed to work with this research team. My outline for this presentation, I'm going to talk about the goals and objectives of the project, the study design, and the implications for treatment and policy. Limitations of current studies in the literature include the following. Few Canadian studies are out there involving Black youth and cannabis use. There are no studies involving Black youth, cannabis use disorder, and a first episode of psychosis. Cannabis use disorder is CUD. No studies exploring the intersections of ethnicity, race, gender, cannabis use patterns among first episode psychosis patients. Early intervention in psychosis is equivalent to motivational interviewing, which is equivalent to cognitive behavioral therapy for cannabis use disorder and first episode psychosis. We need to augment early intervention psychosis treatment so that more people respond to therapies involving cannabis use disorder. Research into the relationship between cannabis use and early psychosis, particularly among Black, African, and Caribbean communities, is one of the main priorities for this project. We also explore factors such as age of first use, frequency, potency, and their relationship to development of psychosis and their outcomes. Other CHR priorities include exploring potential benefits and harms associated with cannabis use in Black racialized communities. What is the study design? Well, we're going to develop a strong participatory and community engagement component, examine the perceptions of mental health effects of cannabis on psychosis among people of Black, African, and Caribbean descent with the first episode of psychosis, establish the feasibility of knowledge acquisition after playing the Back to Reality series versus a control game. This project builds on a community academia partnership since 2019. It involves the Free for All Foundation, which is a charitable organization serving families and youth from Black communities, and the Institute for Advancement of Mental Health, which is the former Schizophrenia Society of Ontario, serving people with serious mental illness and their families. Also, EPION, the Early Psychosis Intervention in Ontario Network, which represents 50 early intervention in psychosis programs across Ontario. I was a former chair of the research working group, and also, of course, McMaster University and undergraduate students. The Advisory Council will advise and monitor the interpretations of the qualitative analysis to ensure that there's no misrepresentation of young people with psychosis or people from Black communities. The project research questions: how do young people with a first episode of psychosis and cannabis use disorder from Black racialized communities conceptualize the mental health impacts of cannabis on psychosis? How are these messages influenced by ethnicity and gender? We're going to recruit young people experiencing a first episode of psychosis and cannabis use disorder, and we'll conduct qualitative assessments about their lived experiences of psychosis and cannabis use. We'll also do qualitative and quantitative assessments of knowledge acquisition after they play the Back to Reality series. So what is the Back to Reality series? Well, it's 3 video games: Harry's Journey, Harry's Journal, and Pathways to Care Map. Harry's Journey tells the story of Harry, who's a high school student of Jamaican descent. When he was 14, he started using cannabis, and that went from weekly to daily use. And in his last year of high school, he started to experience psychosis symptoms. Harry's Journal takes scenes from Harry's Journey, and it's basically multiple choice questions about different things like hallucinations, delusions, anxiety attacks. Harry's Pathways to Care Map is a colorized version of the city of Hamilton with 3D animated images and descriptions of real youth mental health and addiction services located in Hamilton. And we are creating a French language version. The KT objectives of the Back to Reality series include increasing mental health literacy, increasing insight, raising awareness, and using digital content to provide psychoeducation to underage youth and youth with serious mental illness. We used arts-based research methods and our knowledge translation community of Black youth and young people with psychosis, researchers, research designers to create the Back to Reality series. Back to the project research questions. So what is the impact of the series on knowledge acquisition about cannabis and psychosis? We're going to recruit 24 young people of Black African descent with a first episode of psychosis and cannabis use disorder, 24 Black Caribbean, 24 any ethnicity, and 10 French language. And the sites involved include early intervention psychosis programs at university centers in London, Hamilton, Toronto, Ottawa, and Montreal. We're going to recruit 82 participants. They'll conduct a qualitative interview, and then they will be randomized as to which game they play first, the Back to Reality series versus a control game. They'll do a quiz to test their knowledge, and then they'll play whatever game they didn't play, and then conduct the qualitative interview. The PCT quiz tests knowledge of cannabis and psychosis. It has basic questions marked out of 10 with 1 point awarded for each question. And we pilot tested the quiz involving youth experiencing homelessness and found that significant increases in knowledge about cannabis and psychosis when people played Harry's Journey versus the control game. What is the implication of the research knowledge? Well, hospitalization for cannabis-related psychotic disorders in Canada has been steadily increasing even before legalization. With legalization of cannabis in 2018, society will be expected to deliver even more knowledge to youth regarding the mental health effects of cannabis. We want to see whether this program might have an impact of cannabis on psychosis. If there is the opportunity to reduce cannabis use, then there's the possibility of decreased severity of psychosis symptoms, less cognitive impairment from psychosis, improved functioning, decreased risk of relapse, and reduced hospitalizations. The anticipated outcomes include coherent transfer of knowledge, support transition to cannabis use therapies, reach Black youth, and promote readiness for change. Thank you.
Thank you so much, Dr. Archie, for a great presentation. We now have some time for a question and answer period with our audience. We would like to remind you that you can answer, that your question should be addressed in the Q&A box, and please feel free to ask your question, I'm sorry, in English or French. So we do have a first question here. So I might have missed this in the presentation. Where does vaping cannabis comes in?
Actually, that's an important question. And so one of the things that we're doing in this study is we're asking youth about the various forms of cannabis that they're consuming. So what percentage are vaping, using edibles, buds, bongs? So I don't have the answer to that, but I think that that's a really important question for us to understand, how many youth with the first episode of psychosis and a cannabis use disorder are using vaping.
Thank you. So we have another question. Hi, Dr. Archie. Why were those cities used for recruitment? Due to the location of your partner's COPI or some other clinical reason?
I've actually done a series of studies involving cannabis and first episode psychosis involving these centers. So these are university centers that have early intervention and psychosis programs. And part of the reason is that we need to recruit young people of Black African and also Black Caribbean descent. So we're focused on major centers as opposed to smaller communities, just because of the need to recruit a specialized population, so we can do disaggregated race-based data analysis.
Thank you. We also have another question. What is some advice you would give fellow researchers when working with youth and other priority population?
I think the importance of having a long-term relationship with the young people and youth and community engagement. It's so important having community organizations involved, like IAM, the Institute for Advancement of Mental Health. We also have the Free for All Foundation involved, which is a community organization in Brampton that helps Black youth and community members. So we've recruited people from these community organizations to be part of our advisory council, that we have a knowledge translation community that helps us to formulate the research questions to begin with, but also now that once we've collected the data, we'll have the students and the researchers present the data to the advisory council, so that we can so we interpret the data in a way that's respectful and appropriate for these communities, and that makes sense to youth.
Thank you so much. We have another question. How are youth screened to identify if there's an underlying undiagnosed mental health issue? What came first, the chicken or the egg?
First of all, the youth that we're studying all have met criteria for a first episode of psychosis. And so we are just recruiting youth who have already experienced psychosis. And there's actually a fairly substantial literature to suggest that once you experience a first episode and you stop using cannabis, then these youth can revert back to normal functioning. But if you experience a first episode of psychosis and you continue to use cannabis, then that increases the risk of conversion to schizophrenia, but also increased relapse, hospitalizations, etc. So it's a very critical period, and it's a very critical population for targeting cannabis use interventions. And so the whole point of the video games is a way of translating knowledge in a way that the youth can absorb. And we have future ideas about using tutorials led by students, nursing students, undergraduate students, where they convert the research about cannabis and psychosis, and the video games are used to create the objectives and are like the homework assignments.
Thank you. We also have another question here. Great presentation. Assuming the Back to Reality series is an effective intervention, do you foresee it being available for any youth with CUD psychosis? If so, will it be available on app stores or by other means?
Yeah, so it would be available for free, and we sort of see it as something that would be available through family doctors' offices, early intervention programs, addiction services, educational services. And we're also seeing it as something, say, that could be linked to tutorials, so people could actually use it as could undergo not just playing the video games, but the debriefing that happens in tutorials, discussions, say with trained undergraduate students, can be an important asset to use of these video games. So yeah, the whole idea is to disseminate it to Black youth and also to youth with serious mental illness issues, aiming for underage youth, because these are very special populations. The underage youth under the age of, between the ages of 14 and 16, that's a high risk for cannabis use effects. And then once you have serious mental illness, that's another high risk period for cannabis use.
Thank you very much. Alexandra, you can go ahead.
Okay, wonderful. Thank you so much. And our fourth and final presentation is a team out of the Resilience and Social Development. Specifically, we'll hear from Farhang, Maaz, Shahid, and Khulud.
Hello, I think we're having a little bit of internet difficulties. Alexandra, are you back with us? Your mic is on mute.
Apologies for that. Where did it cut out?
You were presenting the presenter for the final presentation.
Okay, sorry about that. Our fourth and final presentation is a team out of the Center for Resilience and Social Development. Specifically, we will hear from Farhang, Maaz, Shahid, and Khulud, Baig. We're so happy to have you folks here.
Hi, everyone. Today we'll be presenting our work so far on the Hash It Out project, Cannabis and Mental Health. The three researchers that were in charge of conducting the interviews have been myself, Maaz Shahid, and the other two were Khulud, Baig, and Farhang. Now, the main objectives of our research study have been to essentially look at the interrelationships between mental health, cannabis use, and also service use by people specifically within the IRER community, or Immigrant, Refugee, Ethnocultural, and Racialized, and specifically youth, so people aged 18 to 30 years of age. What we essentially are looking to do is, when we look at the interrelationships between these three concepts, we're essentially going to create various journey maps outlining some of the different ways that people experience the interrelations between these three. Some of the specific lines of inquiry that we were interested in were, what are the underlying reasons driving cannabis use amongst IRER youth, and what are their pathways into cannabis use? What are some of the unique factors affecting cannabis use and outcomes, and the connection between cannabis and mental health amongst this population group? How can services be redesigned? How can researchers effectively understand and measure prevalence of cannabis use? And also, how does cannabis use differ across diverse experiences of IRER youth, including immigration status and ethnocultural background?
Now we're just going to quickly go over some of the methods and principles that we've been following for this research. So this research is structured to be a qualitative project overall. So we're doing interviews, one-on-one interviews with participants, and participants involve youth, service providers, and parents and families of those who engage in cannabis use. And the project itself is based on experience-based co-design, which means working with youth who have experiences of cannabis use and bringing them in right at the beginning of the project from the get-go and using their experiences in designing, shaping what kind of research it's going to be and what kind of processes are going to be followed. In terms of principles, we have prioritized and identified many principles that the research is centered on. So it's centered on community education. Harm reduction is a really important pillar of our research. We are very much pro meeting people where they're at. There's no shame or stigma involved with mental health conversations or with cannabis use. The research itself, the process itself has been made as low barrier as possible. We provide people a lot of different avenues to be able to talk to us. We're trauma informed. We do a lot of pre and post follow-up after the interview. We've given people lists of resources on what they can use to address any issues or discomfort that they feel as part of the interview process. We're anti-oppressive, which is again one of the very important pillars for us, where we make sure that we're taking in account the intersectionality of the participants and the diverse experiences that people are bringing to the table. And then we're anti-racist as well, just recognizing that particularly with IRER youth, that there are multiplicity of experiences that are rooted in their racial backgrounds and their immigration status and their journeys to Canada or their time in Canada. So just making sure that we're well aware of it and taking into account all of that. And then most importantly, we're pro-empowerment, which really means that people are valued for the labor, whether emotional or personal or even just putting out their thoughts and feelings to us. That's labor that they're taking on. So we're making sure that we're compensating people with an honorarium. We're making sure that they feel empowered by this experience of being talked to about their experiences and have more of an opportunity to do similar work in the future.
So currently we're actually still conducting some of the interviews. So we're specifically conducting actually interviews within 3 specific groups. One is youth, one is service providers, and the third is family and friends and other supports of the population group of interest. So far, some of the preliminary findings that we found is, so we did actually all of our recruitment for participants through Instagram, and within the first week of us opening up our survey, we had over, I believe, 150 interested participants within the first, I think, 3 or 4 days. And on top of that, there has been a lot of direct messages through Instagram. There's been essentially a lot of chatter online and people asking how they can get involved and also showing their appreciation for this topic because they feel like this is definitely a gap that has existed within cannabis research itself. Some of the other findings that we found is that people had both a good level of personal and population level insights, in the sense that there was a lot of personal stories that they shared in terms of whether it's cannabis use, mental health, the relationship between the two, and also their experiences with service providers. But also people have reflected on their journeys and also taken this to have some opinions and perspectives on what this means at a population level. So what are some of the ways that we can implement population level strategies to change the way service provision is done around mental health with cannabis? A third preliminary finding we found so far is that participants themselves are definitely in the middle of various intersections. So they're not only racialized or only cannabis users or only have perspectives on mental health, but rather they exist in the crossroads of a lot of different experiences that we are interested in getting. The other thing that we found is with all 3 of us researchers being ourselves between 18 to 30 years of age and also racialized, participants were very comfortable and really appreciated being able to open up and not needing to have to explain their experiences to us, but rather understanding and also being very vocal about the fact that we understand where they're coming from. There's also a lot of interest in discussions around specifically the mental health aspect of cannabis. So, for example, not only looking at the positive or negative outcomes of cannabis, but rather why people are smoking cannabis, or also how their mental health fluctuates both before and after cannabis use, whether that increases the frequency of cannabis use, whether that decreases it. Essentially, people were very interested in getting to the meat of this intersection and not just surface level. Also, they're very supportive of the harm reduction approach that we've used, in the sense that, like I mentioned, we aren't just looking at positive and negative, but we're looking at people's entire journeys, people's context, and that kind of really helps with future service provision, because it allows service providers to look at people within their context and not necessarily simply a way to tick boxes and apply one-size-fits-all approaches, but rather learning to appreciate people when they come and essentially taking them for their whole context.
In terms of some of the implications of the project, we've kind of talked quite a lot in our planning processes about previous and continued alienation of IRER youth in existing institutions, so healthcare, academic, and carceral. In many of the interviews that we've done, we've seen legalization of weed come up. So I think the project is probably going to have a lot of new data and research around what kind of differences did legalization make for IRER youth and their use of cannabis. We've talked a whole bunch about how youth access healthcare and services and what are some of the implications of dealing with mental health challenges or navigating mental health and cannabis use within existing services. So that's probably one of the areas that our research is going to inform. We're hoping that this data is going to be very critical in informing some policy and legislative change, but then also just creating a larger push towards looking at IRER youth experiences with cannabis use and the way that they've been navigating cannabis use and mental health and what that looks like for the youth themselves. So there's that as well. And then as well, we've just kind of also wanted to talk about a little about some takeaways for general audience. So understanding that any sort of research that is being done on substance use or on mental health is going to be very context-based, based on participants and their unique experiences, and that needs to be acknowledged. And it needs to be acknowledged that these experiences are never the same. They look very different for different populations, and acknowledging those differences and specificities of context can have a huge difference in the way that policies and legislative changes are looked at. And then finally, it is also just kind of important to acknowledge that the research was taken upon during the pandemic, and a lot of people have experienced changes in their own substance use habits during the pandemic, but then also that has been a barrier for us in reaching out to people and talking to people one-on-one. We've been doing interviews over Zoom, and some people prefer them and some people don't, but overall there have been delays and there have been ways that we've had to change the project overall just because of the challenges posed by the pandemic.
And lastly, this is one way that you can contact us if you have any questions, but definitely thank you for taking some time out, and we look forward to your questions.
Thank you so much. We do have a few questions. Let me just grab them. So the first question we have is what advice you would give to fellow researchers when, oh my gosh, I'm so sorry. Oh no, this is it. What is some advice you would give to fellow researchers when working with racialized youth?
I think my answer actually would be very similar to the presenter before me. I feel like there's a little bit of static. Can you hear me?
Yeah.
Yeah. Okay. Yeah. My answer honestly would be very much the same as the previous presenter, in that definitely look into doing a lot of research and understanding what are some of the different experiences that racialized youth have, but then also kind of looking back at your processes and making sure that there aren't unnecessary barriers for them to participate, but also how can your kind of research be better oriented to meeting their needs, and also like changing it so it's reflective of their like different experiences. Those are just some of the things that kind of directly come to mind, and some of the ways that racialized youth can be better accommodated when it comes to doing research.
Okay, wonderful, thank you. I would also just like to do a reminder that for your question to be addressed, you must first type into the Q&A box. So please feel free again to ask your question in French or English. The next question is, you spoke to intersectional identities and experiences of the project participants. How do you imagine exploring that more deeply? How do you hope to explore that more deeply in the analysis stage? And then it says it has a little caveat, i.e. people don't fit into neat boxes.
Yeah, that's a very good question. So essentially what our analysis stage will be is we're kind of going through the process of doing, locating themes in a lot of the interviews. And essentially what we're going to be doing after that is creating journey maps. So the idea is we will kind of be creating journey maps of all of the different ways that people spoke about their various contexts and experiences between cannabis and mental health use. And then we're kind of taking those journey maps back to the participants. So we're conducting some focus groups with some of the participants. And in that, we're kind of hoping to get or ask essentially participants themselves to validate and verify some of their findings. So we're kind of trying to see how we can, on one hand, pick out some themes, but at the same time, make sure that the youth themselves feel that these themes and this journey map accurately reflects kind of what they were speaking to when we were conducting our interviews.
Okay, wonderful. Thank you. And then our next question, just being typed up right now, is can you talk a little bit more about what a journey map looks like?
Sure. Actually, it would have been probably a good idea for me to have an example of it right now to share, but unfortunately I don't. But essentially the idea is to see, you can think of it almost as a visual narration. So kind of looking at a roadmap of somebody's, let's say, experience from when they first started cannabis use to where they are now. So it's kind of like a different tool of research, a different tool of knowledge translation to allow the results that we're collecting to be displayed visually, but also it's not necessarily a chronological representation, but rather they have what are called touch points. So the idea is like, are there different ways where different people have similar experiences throughout their journey? Or is there similar, there's also something called pain points. So are there some intersections where people of different, you can say groups or intersectionalities are having similar, positive or negative experiences with service providers, for example. So that's kind of like one way I describe what a journey map looks like. We kind of hope to have the journey maps done by mid-March, end of March. So if people are interested, we definitely would love to share our findings once they're done.
Okay, wonderful. Thank you so much. And that's all the time we have for questions for this presentation. Thank you again so much for sharing your work. We feel very fortunate. And now we actually have some time for some general questions for all panelists. So the first question is, how has the pandemic impacted your ability to conduct research?
Do you want us to go in any particular order, or?
No, you can just feel free. We can do a bit freestyle, have a bit of conversation.
For our team with Compass, it actually ended up being a really good thing, oddly enough. Traditionally, we used to do everything with paper-based questionnaires because that's what schools were comfortable with. And it was quite an expense to be able, and logistics associated with getting 65 to 70,000 questionnaires out to students in high schools across Canada. With the pandemic, the schools that were participating in Compass still wanted the data even when the pandemic initially started. So we transitioned all our methods and got the ethical approvals to transition to online questionnaires. So that created a new mechanism that saved us a lot of money as researchers, but also built in the flexibility to be able to tweak aspects of our questionnaires to different provinces a lot easier than we could have done by maintaining the paper-based questionnaires. So we actually saw it as it ended up being a really good thing. It was a pain in the butt at the beginning. But once we adapted to it, the schools were a lot happier because it was a lot less burden on them, which is a really important part of this kind of work. The students were happier because then they could complete it at school, but then they could also complete the surveys on their own time outside of school on their handheld devices. And as our research funders were happy because now we can make the money go a lot farther. So that's my answer.
For our team, I would say it was negative and positive. We had planned to have a diverse group of youth as our working group located meeting at the clinic, at the youth clinic, and where they actually get with the experience of a multi-group team working together. So we ended up kind of being delayed by COVID because we had to switch strategies. And secondly, I think that interconnectedness that happens in in-person meetings it took a little while to build that. So we ended up, with the youth that have stayed with us, 6 youth over multiple meetings by Zoom. That I think that relationship building has occurred, but and the other advantage was that we were able to recruit youth from across the province, not just in the city, not just in Victoria. So that was a gain. But I think again, in community-based research, when you're really trying to get people's involvement and sharing with each other and learning from each other, that was to some extent hampered by COVID. Thank you.
Would anybody else like to jump in? And if not, we can move on to the next question.
So, Suzanne, Archie speaking now. I think that there were some improvements and some drawbacks for the study design. I think one of the main drawbacks is that for our game, we had to change our criteria for detecting video game addiction. So we didn't obviously want to recruit participants who might, be harmed by playing our video games. But what happened is with the pandemic, everyone was scoring high on it, which was a change because video games became, an important pastime when nothing else was available to you. Couldn't go to the movies, couldn't see friends, et cetera, et cetera. So we had to go back to the REBs and loosen the criteria for video game addiction because it wouldn't have been generalizable because that all youth were playing more video games. And so that was one thing that we found. Because our recruitment is clinic-based, it does make it a little harder to recruit because normally while youth are waiting to meet with their nurse, their social worker, their doctor, whatever, that's a good time to, approach, recruit, once we have permission from their clinician. Zoom is not the best for our population anyway, for recruiting. So, I mean, Zoom, the benefit is Zoom allows more flexibility around, people not having to drive to a location. So that basically was the benefit.
Wonderful, thank you.
Oh, sorry, I was just going to say.
No, go ahead.
No worries. For myself, it was definitely a bit of both. There was a lot of there were some delays because of the pandemic. Obviously, with everything shutting down, we kind of had to reorient. We had to kind of redo some of the ways we were planning on conducting the interviews. One of the positives, though, is when we were doing it over Zoom, we were kind of able to give participants the autonomy to kind of be involved at the level that they were comfortable. So, for example, if they wanted to be on video and give us information, over video, then they were able to do that. If they wanted to be involved only, no video, audio only, they were also able to be involved in that respect. So it kind of gave participants a little bit more autonomy, depending on how anonymous they wanted to be. The only information we needed to collect regardless was just their email, and that was simply to send them honorariums for the research. So it's definitely a little bit of both. And I think the other thing I wanted to kind of throw in quickly is, I think the pandemic also gave us a very interesting opportunity to kind of reflect on our own experiences during the pandemic and kind of have this kind of a very common point to talk about with participants in the sense that, even getting them to ease up and open up a bit more. You can kind of talk about a little bit of other things and then jump to the topic. So that's kind of some of the ways that the pandemic affected.
Okay, wonderful. Thank you so much. The next question we have is, what would you like to see more of in terms of cannabis and mental health in youth, i.e. research, education, policies, etc.? And before I get you guys to answer this, I would just like to ask all of our presenters if they could please put their contact information in the chat section, so anybody watching this webinar can contact them with any questions, further questions. Anyway, continue.
One of the things I would like to see from some of the research we've done is just for there to be more accurate communication around the potential health benefits of cannabis. I know depending on the mode that you use, still a combustible product, so there's still some risk with that. And I know there's a whole bunch of myths floating around with youth about the potential health benefits and the risks. And I just think we need to have a more open discussion, I think, with kids about what the potential risks and harms are, but if there are, so are some benefits. And I think we need to have a more open discussion around the harm reduction approaches associated with cannabis use, especially with youth populations, whereas some use okay versus at a complete abstinence model. My role as a researcher, I'm indifferent to those things. We're based more on surveillance and evaluation, but I think there needs to be some more consideration around that. And finally, I think the thing that's missing in tobacco control decades ago, we had a ton of success in reducing smoking among youth populations because there were these coordinated, comprehensive approaches to smoke-free Ontario strategies or national strategies, et cetera, that worked quite well. If there was really a concerted effort to do something about cannabis use or substance use more generally in youth, I think we should go back to those kind of more comprehensive models that work at multiple levels of influence, not just these one-off programs in schools and things like that.
Yeah, and I would add that involving youth themselves in these discussions, people with the lived experience, whether it's negative or positive, the diversity of youth, not just youth in schools, but who are street involved and in various situations, so that we have a comprehensive understanding about how cannabis could benefit people in the short term, but maybe not in the long term. So we need and also the intersection with other kinds of substances as has come up today. So, and not just thinking substance use in relationship to cannabis, but how it intersects with other substances, and then looking at the social determinants of or background of youth who are heavy users and so on. But most importantly of all, I think having youth at the table, their voices, diversity of them being heard in any kind of comprehensive policy.
Would any other presenters like to go ahead?
So I would like to see much more research on medicinal marijuana. I think that people use marijuana for sleep, for coping with anxiety, and I think that that the government needs to fund clinical trials and much epidemiological research on medicinal marijuana. I'm surprised at how little funding there is for that. And then, I mean, this is I also would like to see more funding of education for educating underage youth and youth with serious mental illness about, the positive and the negative impacts of cannabis use. I think that, and a lot of people here are doing that research, so I'm, as well as myself, but I think that it's really needed and very important. So I'm glad that the Mental Health Commission of Canada has put a significant, has funded a significant number of projects that are aiming to do that. So thank you.
I think another quick thing I can throw in as well is two things actually. One is, I think the potential of social media to be used in many different types of research is pretty big, both for contacting and involving youth, but also for the dissemination results. I feel like even though there is some progress that has been made over the last couple of years on social media being used, I think it's still quite an untapped market, because even this was actually my first research project doing it on social media. And honestly, like the involvement we had within the first few days was pretty like unlike a lot of other research projects I've been a part of. Second thing I wanted to say is I definitely echo, I think it was Dr. Benoit that said, involving youth from the get-go, but also involving them as a very like same level stakeholder, in the sense that youth are very aware of their problems. They simply just need the proper tools and resources to be able to advocate for themselves. So I think that those are two things that can definitely enhance the type of research being done.
Okay, wonderful. Thank you so much. So before we go into closing remarks, I would just love to ask if you guys have any final thoughts, the presenters, or any final statements to add.
My only is to thank the Mental Health Commission of Canada for funding us all, and to having this conversation, and especially involving youth as yourselves as narrators, and I really like the whole approach of the webinars, that they're really trying to get research results out early on, and having opportunities for us to get some feedback, some really good questions, and then to go forward. So thanks very much.
Yeah, I would echo those comments. I think this is a great opportunity for people who are coming at this issue from a variety of different perspectives to present what's going on. And I think you are seeing similarities across these different platforms for what we're finding with youth, and that kind of triangulation is always good. I guess my final 2 cents would be is that we need to make sure when we're looking at this issue that we're not just looking solely at cannabis use as the only driver of these things. It's really complicated with youth. Things tend to be multifaceted, and cannabis is incredibly important, but it's also how it ties in with the other positive and negative things kids are doing in their lives that can either make it better or exacerbate the problems.
Thank you very much. And we have a last comment here. All of this research is so interesting. Thank you for sharing with us today. So if there's no other question or comment, this will conclude the question and answer period. We just want to sincerely thank all of our presenters for sharing your time and expertise with us today. On behalf of the CCSA and MHCC, we would like to thank everyone who participated in this second webinar of our Cannabis webinar series, Winter Edition. This webinar was informative, and I believe it helped those close key research gaps in cannabis and mental health for youth in Canada. So thank you for attending today. Thank you very much, everybody.
Thank you very much.
Thank you.